Point-of-care ultrasound for appendicitis is one of those applications that not everyone has bought into yet. Most of us that do it still feel frustrated when we find a glowing big appendicitis on ultrasound, and it has a blind end, and it's non-compressible, and it's more than 6 millimeters, and it's for sure ruled in. And then we still have the time delay of undergoing traditional workup pathways. The surgery services often don't want to see these patients until they've had either a radiology department ultrasound or a CT. And so we sit there for a few hours, basically waiting for the old system to catch up to us. And that's been something that's you just tolerate. But recently, I've begun to feel a bit of an ethical quandary around this, because the PEM community has been debating on social media and on listservs these two new papers that are really disrupting the idea of traditional care of appendicitis. Both of them are from groups in New York, and both of them begin to quantify how rates of perforation increase with time delay, how every hour that passes from the diagnosis of appendicitis to surgery can increase a child's rate of perforating. And we know that perforation is a bad thing. It means a longer hospital stay. It often means invasive drains. It sets kids up in the future for long-term side effects like intestinal obstruction. So what do we in the POCUS community do now that we've made the diagnosis and we know that these few hours of non-surgical planning exposes these children to harm? And for me, this is something that eats at me a little bit. And I think it means it's time for us in the POCUS community to really prioritize research that shows what we already know, that there's a big time savings using POCUS when you rule in appendicitis, and we can use that time savings to decrease appendicitis perforations. This means getting other stakeholders on board. We need surgeons to buy into what we're doing. We may need radiologists to buy into what we're doing, because what if it's as simple as saying, I've already recorded clips that show appendicitis. Can you overread them? Because that's what the traditional pathway wants. It wants a radiology diagnosis. I know that means a little bit of decreased ownership within the POCUS community, but I struggle with what's more important, ownership or better patient care. So these are exciting controversies that we're sure to have updates on in the future. So if you like hearing about these kinds of emerging trends, remember to like us and subscribe.